This is my go-to first line of therapy when you get sick. You have any kind of cold symptoms, you're exposed to anybody who has a cold or any kind of flu-like illness, respiratory illness, do your nebulizer. The most important thing about treating any kind of viral infection is early intervention, early treatment. So start with your nebulizer, keep this on hand, make your solution up fresh. This is number one. If you start this immediately even within a few hours of starting to feel sick, you will be able to basically beat this virus and not let it take hold and replicate and cause illness. So you just bought your nebulizer kit, and today I'm going to demonstrate how to use this. It's quite simple, and I just want to make sure you get the dilutions right of all the materials and then how to use your actual nebulizer machine. In your kit, you're going to have a nebulizer, you're going to have a mask, and then a spare mask. You will also purchase the normal saline solution, which is sterile, the Lugol's iodine, a mixing bottle, and then the food grade hydrogen peroxide. It will also come with 2 syringes. This one is for measuring the solution into the nebulizer, and then this one is for measuring your hydrogen peroxide. We're going to start by making the solution. So the first thing I'll do is I'll take my 60 ml amber bottle, and generally for the ingredients we have you mix up 30 mLs, which is half of this bottle. So you'll just, as you can see, it's got the sterile seal on it. You just take that off, and then you just pour 30 mLs, and the gradations are on the side. They're kind of hard to read, but the 30 mLs is right there. So you're going to just fill it to that mark. So you just pour your sterile saline solution in there. And if you want to use your syringe, you can do that, but I like to mix fast because I'm busy. I'm sure everyone else is. So there's, that's 30 mLs. That's the 30 ml mark right there. And then I'm going to take the Lugol's iodine and I'm going to add 3 drops. 1, 2, 3. And then the last thing I'm going to add is I'm going to add 1 milliliter, which is basically this whole syringe. So 1 milliliter is the whole syringe of hydrogen peroxide. So I'll take the syringe, I'll put it into the bottle. Okay, that's 1 milliliter, and then I put that in the bottle. And now that's done, I just recap it. Now these are not sterile because the peroxide will actually sterilize everything. Make sure you put your lid back on to preserve that peroxide. And then you can mix the solution within the bottle. You can just shake it a little bit. And then you use your 5 milliliter syringe to measure out your dose. Each dose will be 5 mLs of the solution in the nebulizer well. And so this is going to make up 6 doses. Now you can double that, make it to 60. You just put 6 drops of iodine and 2 ml of the hydrogen peroxide, and that'll give you 60. I generally will mix 60 at a time because in acute illness, you're going to use this 3 times a day, and that would last you 4 days. So I don't like taking the time to mix it, so I just double the mixture, and then I have a total of 12 doses in here. Now, if you've had this sitting for, say, a few weeks, just toss it and make up a fresh solution because the peroxide will degrade over time. Next, I'm going to show you how to use the nebulizer. This is the nebulizer that we sell in the pharmacy, made by Henry Schein. The first thing we're going to do is I'm going to show you how to connect the mask. The nebulizer actually comes with this mask. It's got the yellow cap in there. This one is not as big, but this could be used as a spare for a family member if you want. We actually give you another mask. It's a little bit larger. It covers more of the face this way. I like this one better, and they're not very expensive, but it's a very effective mask. So first you just connect the hose to that end, and then you have the other end of the hose, and you connect to the nebulizer. So now we're all connected. So next thing you do is plug your nebulizer into an outlet, and now it's ready to go. I want to go through this just to explain it, but this is where confusion sometimes comes in. So this is the well where the liquid solution is going to go. So it's just got a screw cap. You just twist it, open it up, and now you've got the well where the solution is going to go that we just made up in the amber bottle. Now, one thing is, in here, there is a little device, a little green device. Do not throw this away. This is very important. Without this device, you will not generate a vapor. So it will do nothing. So without that, little device in there, you won't be able to generate the vapor. On your spare mask, same thing. It has another, look, that just came out. It looks like little angel wings or a Celtic cross, but that goes in the bottom of the well, and then you screw this on, and then you can generate a vapor. With the mask, without these inserts in there, you will not generate a vapor. So the next thing I'm going to do is I'm going to fill the well. Now the well does have actually graduated markings here. The top one is actually 6 cc's, which is the same as 6 milliliters, and we're going to just put in 5. So you can actually just pour this in, and you can see the markings, or if you want, you can draw the solution up in the syringe. This is a little more precise. So this is 5 milliliters, which is 5 cc's, same thing. So I'll put that down into my bottle. I'll draw up 5 mLs, and got a little bit too much. We'll push that a little bit of that fluid out. Now I'm at 5 milliliters, okay? So I'm gonna put this into the well, put it in the side next to that little green device in there, recap it, screw it on, and now I've got it plugged in. We're gonna turn it on. It has an adjustable strap, so you can just relax, you can read or do whatever you want when you're running this, and then you just turn it on. It makes this kind of noise. You see the vapor coming out. This is what you want to breathe in. So I'll put that on. And just realize you don't have to breathe rapidly, just normal breathing. I try to breathe in through my nose, and you can exhale through your mouth. You can take a few breaths in through your mouth if you have any kind of sore throat as well. But the main thing is you want to get it into your nose. So you breathe in through your nose, and that's going to help sterilize that area of the nose to help clear any viral infections, bacterial infections. So this is my go-to first line of therapy when you get sick. You have any kind of cold symptoms, you're exposed to anybody who has a cold or any kind of flu-like illness, respiratory illness, do your nebulizer. This is number one. If you start this immediately, even within a few hours of starting to feel sick, you will be able to basically beat this virus and not let it take hold and replicate and cause illness. So the most important thing about treating any kind of viral infection is early intervention, early treatment. So start with your nebulizer, keep this on hand, make your solution up fresh, and just start nebulizing 3 times a day in the acute phase of an illness, 1 time a day if you're using prevention, or twice a day. And then after that, you can reduce the frequency. But this is a very effective treatment, very safe, very few side effects, if any, and I recommend it.